Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient following an AV shunt placement. In this module, you'll learn what's involved in caring for a patient of this type and how to deal with the special circumstances the patient presents. We'll begin with the first information you receive on the patient, the report from the recovery room nurse. The summary report you'll hear today uses the SBAR method: situation, background, assessment, and recommendations.
Med-Surg.
Hi, this is Beth from Recovery Room, and I would like to give a report on Cynthia Williams.
Hey, Beth, this is Kent. I'll be taking her today, so you can give me a report.
Okay, that would be great. Well, her surgery is complete, and she's ready to come up to her room. Are you ready?
Yep.
Okay. Cynthia Williams is 55 with no known allergies. She is Dr. Rogers' patient, and she's being admitted post-operatively for an AV shunt placement.
Okay, any past medical history?
She has end-stage renal disease, a history of uncontrolled type 2 diabetes, and uncontrolled hypertension. She was started on dialysis 3 weeks ago. She's been receiving dialysis through a permacath in her left subclavian, and she'll continue to receive it that way until that AV graft heals. She is scheduled for dialysis later this evening.
Okay, how are her vital signs?
Good. Temp 98.4, blood pressure 118/50, with a heart rate of 70, a respiratory rate of 20, and an oxygen saturation of 98% on room air. Post-operatively, she's been ordered the following medications: Percocet, Foslo, Renagel, Lisinopril, Norvasc, Glipizide, and sliding scale insulin coverage with AC and HS finger sticks. The only medication she's taken today are the Norvasc and Lisinopril.
Okay.
Okay, now here's her systems assessment. Neurologic, she's awake, alert, and oriented ×3. Cardiovascular, her heart rate is regular. She has a permacath in the left subclavian. She received 300 cc's of normal saline through the IV in her left hand. The shunt was placed in her right forearm, and the site is a little swollen. It has steri strips on it, which are clean, dry, and intact. There is a positive thrill and bruit at the site, and she'll receive dialysis tonight through the permacath. Respiratory, her lungs clear to auscultation. Gastrointestinal, her abdomen is soft, non-tender with positive bowel sounds. Blood sugar was performed post-operatively, about an hour and a half ago, and the blood sugar was 220. We did not administer any insulin. For you, she'll be started on a low potassium, low salt, low protein diabetic diet. Genitourinary, the patient has not voided for us. She says she still voids a small amount occasionally. Integument, her skin is clean, dry, intact.
Okay, do you have any recommendations for me?
Yes, I would recheck her blood sugar and administer any needed insulin prior to resuming her diet. She is also going to need some education about the need to avoid blood pressures and blood draws in that right arm.
Okay.
Any questions?
No, that's it. You can send her up anytime. Thanks.
Okay, she's on her way. Thank you. Bye.
Bye-bye.
You're about to watch a registered nurse conduct a focused assessment of a patient with renal failure who has just undergone AV shunt placement. Note how he performs each step and, just as important, how he explains what he's doing to help the patient understand what's being done and why.
Hello, Mrs. Williams.
Hello.
I'm Kent Bachman. I'll be your nurse today.
Okay.
Give me just a few moments. I'm going to get some things organized, all right?
All right.
Okay. Let me just wash my hands. Be right with you.
All right.
right, let's begin by checking your ID. Can you please tell me your name and your date of birth?
Cynthia Williams, January 17th, 1954.
Thank you, Mrs. Williams. Do you have any allergies?
No, I don't.
Okay, you are who you say you are. So, I understand you had some surgery today.
Oh, yes, I did.
When caring for a patient returning from the operating room, it's a priority to assess pain and to physically assess the surgical site. Notice in the following example how the nurse covers these factors early on in the assessment.
How are you doing right now? Are you feeling any pain?
Not much, really.
Okay, well, if we put it on a scale of, say, 1 to 10, 1 being least, 10 the greatest, how would you rate your pain at the incision?
I'd say about a 2.
Okay, so then in terms of getting pain medication...
Oh, I really don't want that right now.
Okay. Please let me know if that changes. It's very important that we keep control of your pain. If it becomes too severe, it's difficult to manage, okay?
Okay, I'll keep that in mind.
All right. Next thing, I'd like to check out that arm if I might. Is that all right?
That's fine.
Okay. Let me raise your bed up a little bit.
Okay.
I'm just going to wash my hands again, get some gloves on. Okay.
What are you looking for?
I'm looking for any redness, drainage, or swelling around the incision site. I don't see any redness or drainage. It is a little swollen, but that's not unusual right after surgery. And next, I just want to make sure the graft is functioning properly. I'm going to do that by listening and feeling for the blood flow through it, okay?
Okay.
So here we go.
When caring for a patient with an AV graft, it's important for you to auscultate for a bruit and palpate for a thrill. These positive findings confirm the graft has adequate blood flow and is functioning properly. If you're unable to auscultate a bruit or palpate a thrill, it's important to immediately notify the doctor.
What did you hear?
I hear a rumbling sound, and that's good.
Okay.
That's what I want to hear. Now I'm feeling for vibrations from the blood flow.
Do you feel it?
Yes, it's good.
Okay.
Next thing I want to do is check your pulse in your right hand. The surgery you just had can actually decrease the circulation in your hand. I assess for circulation by checking your pulse and your capillary refill. So let's check the pulse. Okay, that's good. Feels strong.
What is capillary refill?
Well, it's what I'm doing right now. I'm going to gently press your nail bed and then wait to watch how quickly the color returns. Normally, the color comes back in less than 3 seconds. Your capillary refill is normal. Good.
Okay.
Okay, your arm looks great, Mrs. Williams. I just want you to let me know, though, if you begin to feel any tingling or numbness in your arms or if you have an increase in pain, all right?
I'll do that, but can you tell me if they're going to do the dialysis tonight through the graft?
No, tonight the dialysis will be done through your permacath. In a couple of weeks, your graft or fistula, you hear both terms used, is going to be ready to use for dialysis, all right?
Okay.
Okay, I'm just going to wash my hands, get rid of my gloves. I'll be right back.
All right. Thank you.
Okay, let's go ahead and do your vital signs, all right?
Okay.
Let's start with your temperature. Okay, under your tongue, please. Thank you. .5.
All right.
That's good. And next, we're going to check your blood pressure. Now, you know how this works. We're going to put the cuff on your arm, and then it's going to tighten up as I squeeze air into it, all right?
Uh-huh.
Okay. And just relax your arm. Thank you. Here we go. Okay, 110/50. Good. Now, you'll notice I took your blood pressure on your left arm. That's to protect the graft that was just created on your right. The same thing goes for any blood draws. They should always be done on your left arm, okay?
Okay, that makes sense.
All right. Now let's check your heart rate. Just relax your arm. Okay, your heart rate is 70, and your respiration rate is 20. Next, I want to check your oxygen saturation.
All right.
This one's easy. Just give me a finger. That's great. Thank you. Just relax. 98%. Good.
Okay.
Now, next thing I'm going to check is your heart. I want to listen to your heart sounds. I'm going to need to listen, though, underneath your gown, if that's all right.
Sure.
Okay, let me just close the door for some privacy, all right?
Dr. Bender? Paging Dr. Bender, please.
When performing a cardiac assessment, listen to the 5 areas of the heart, assessing for any abnormal sounds. In patients with end-stage renal disease, a rapid irregular heart rate is a common finding. Be sure to document the heart rate and rhythm after your assessment and notify the doctor about any abnormal sounds.
All right, here we go. Up top. Thank you. Careful here. All right, then I'm gonna come up underneath here. Thank you. You're fine. Easy. All the way up here. Good. Okay, and for this next one, I have a favor. I just need you to roll a little bit onto your left side. Be careful of your graft. That'll help me listen for any abnormal sounds, all right?
Okay.
Good, that's fine. Just like that.
All right.
Right up under here. Good. Okay. No unusual sounds there.
All right.
Good. Now just lay back, nice and easy. Careful of the graft, all right? Okay, now I'd like to check your permacath and IV sites, all right?
Okay.
When conducting this part of your assessment, check the permacath and the IV site for redness, edema, and drainage.
Okay, are you feeling any pain or discomfort here?
No, not at all.
Good. Both sites look great.
Okay.
All right, next, I want to listen to your lungs, but I'm going to need to do it underneath your gown again. Is that all right?
Sure.
Okay. What I need you to do is just take deep breaths for me and breathe through your mouth.
Okay.
We'll do front, then back.
All right.
Okay.
When performing a respiratory assessment on a patient with renal failure, listen for any abnormal lung sounds, paying particular attention for rales or crackles. These are signs of fluid overload.
Okay. I'm going to reach up under here now, if I may. Thank you. There we go. Great. One more over here. Great. There. Okay. Now, if you could for me, just lean forward. I'll help you. Carefully, your graft. Nice and easy. That's fine, right like that. And keep breathing. Good job. One more. Okay, and back, nice and easy. Okay, I heard some mild rales.
That doesn't sound good. What is that?
Well, it means there's extra fluid in your body right now, and the lungs are a spot where the fluid tends to back up. It may sound bad when I talk about it, but it's really not unusual, especially on a day you're scheduled for dialysis, and considering you got extra IV fluids with surgery.
Okay. And will the dialysis make that go away?
Yes, the dialysis will remove extra fluid and waste products from your body.
Okay.
Okay, Mrs. Williams, are you feeling nauseous at all? Sometimes people feel just a little bit sick to their stomach after surgery.
No, not at all.
Okay, then what I'd like to do is listen to your stomach with my stethoscope, and I just need to listen underneath your gown again, if I may.
Sure, that's okay, but what are you listening for?
Well, when the stomach and intestines are doing their job, they make gurgling sounds.
Oh.
All right, let's see. Okay. I hear gurgling sounds in all the areas.
Okay.
And next what I'm going to do is feel or palpate your stomach. I'm feeling for rigidity, firmness, or tenderness. Now, is any of this causing you discomfort or pain?
No, it isn't.
Oh, Mrs. Williams, I know it's just about lunchtime. Are you hungry?
Definitely.
Okay, I'll try to make sure they get your tray in here soon. But first, I do need to check your blood sugar and get you your insulin, all right?
Okay.
Here, let's just double check your ID, please. Could you repeat for me your full name and your date of birth?
Cynthia Williams, January 17th, 1954.
Terrific.
Okay.
All right, let me just check here. Okay, great. Let me just clean some things up and put some gloves on. We'll be ready to go.
Okay.
All right. Let me turn the machine on.
To perform a glucose assessment, open the vial, remove the test strip, and recap it immediately. Then insert the test strip into the meter. Check the code number on the strip to be sure it matches the code number on the monitor screen. Next, Wipe the patient's finger with an alcohol swab and allow it to dry completely. A best practice to decrease the patient's discomfort is to use the side of the fingertip instead of the center, and to use a finger other than the index finger. Massage the side of the finger toward the puncture site. Then hold the lancet perpendicular to the site and pierce the site. Wipe away the first drop of blood onto the gauze. Then gently touch the next drop of blood to the pad on the test strip. Using a cotton ball, hold pressure on the puncture site. Read the blood glucose results, document the measurement, and inform the patient of the results.
Okay, your blood glucose is 230.
Okay.
When finished, dispose of the lancet in an appropriate container.
Okay, according to the sliding scale in your chart, you will need 2 units of regular insulin, which I'll bring in just a few minutes.
Okay.
Okay, so before dinner tonight, we're going to restart your glipizide, but we need to keep checking your blood sugar and give you the supplemental insulin until we get that blood sugar down into the normal range. It's very important that we keep control over your blood sugar right now, especially after surgery. With the blood sugar too high, that can increase your risk for infection.
I have a question for you about my meals.
What is it?
The last time I was in the hospital, they never would send me what I ordered from the menu. Why is that?
That must be very frustrating. I'm sorry.
Yeah.
They put you on a low sodium, low potassium, low protein diet. Did they explain to you why?
I remember someone talking to me about diet when I was first diagnosed, but I was so nervous. I forgot a lot of what I was told.
Okay, I can help you with that. You've been placed on a low sodium diet because sodium can cause the body to retain extra fluid, and right now your kidneys can't get rid of that.
Okay, so that explains the low sodium.
And potassium, well, that's a substance your kidneys would normally excrete and keep in balance. But because your kidneys aren't able to do their job right now, your potassium level could get too high. And this can lead to what we call arrhythmias, which means your heart won't beat properly, and that can be a big problem.
And the low protein?
Well, although your body needs protein to stay strong, the byproducts of protein digestion need to be removed.
And my kidneys can't do that anymore.
No, that's right.
Okay.
So you can see it's important that you maintain this type of diet so you can reduce some of the side effects of renal failure, like itching and weight gain. If you like, I can call your dietitian, have him come and talk to you about the foods you like to eat and see how they can be incorporated into your diet.
Oh, that would be great.
Okay, terrific. I'll do that. I'll also bring your insulin into you soon.
Okay.
Is there anything else you need from me right now?
No.
Okay. Do you have your call bell?
Oh, yes, right here.
Okay, just buzz me if you need anything.
Okay.
All right, I'm just going to straighten some things up and I'll see you later.
All right, thank you so much.
After completing your assessment, you will return all of the equipment and promote good infection control practice by washing your hands.
Paging Dr. Bender. Paging Dr. Bender, please.
When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. The final step of your patient visit may be to develop your nursing diagnoses. Based on your assessments, the nursing diagnoses for this patient could include fluid volume excess related to compromised regulatory mechanisms, risk for infection, and knowledge deficit related to condition and treatment. Thank you for watching this video on caring for a patient following an AV shunt placement. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.